Hi, my name is Kelly Grosklags, and I'm coming to you today from Minneapolis, Minnesota. I have had the privilege to meet some of you in person, and for those of you that I have not met yet, hello. I have worked in the field of oncology, palliative care, and hospice for close to 28 years and had a private practice here in Minneapolis for 17 years, working specifically with people who were on the younger side, but also many of my patients had a terminal diagnosis from some form of cancer. So I've been asked today to talk to you about what kinds of things you might consider if you want to talk to your healthcare team or your family or your friend group about end of life issues. And today, what I think is really important is that it's okay wherever you're at. Some days you may feel like you want to be done with your maintenance treatment or you want to be done with your clinical trial. And some days you may feel like you want to continue. This can be confusing to people themselves as well as family members. But I just first of all want to start off by saying that embrace where you're at today and just know that that can change, and allow yourself to have emotions and allow yourself to experience all the things that come up for you. Truly, all your emotions matter. And for some people, you can feel very confident in your decisions. Some people can have a lot of fear and uncertainty. Some people feel that they can't even tune in anymore because they feel like their voice has just gotten lost in the opinions of others. So one of the things that I work with my patients on is being quiet and being still and tuning in and see if you inside can tune into what feels the most authentic for you at the moment. I also encourage people to write these things down. I think it's important to know, again, that these things are going to change, but to start writing down your feelings about how are you feeling about your disease process right now, wherever you're at. How are you feeling about the treatments that you're on? Do you experience quality of living? Are you getting to participate in the things that matter most to you? And if the answer is no, what's getting in the way? So it's about these conversations, these life goal conversations, or these quality of living conversations should really be starting with your oncologist on day one of your diagnosis or day one of your metastatic diagnosis, where you sit down and have a conversation about what is going to matter, what matters most to you. Some of my patients say it's the most important that they have alertness, that they would trade having some discomfort in their body to be more alert. Some people say they do not want any pain to the best of their ability, and they're okay with feeling more tired because of pain medication or whatever. This is something that only you can decide. And I think it's important to sit down and write what matters most to you. Now, for the purpose of this conversation about actually having discussions about when you want to talk to your provider about possibly stopping treatment and phasing into more of a hospice part of your living, and talk to your family. Now, sometimes people can be met with resistance by their providers or the people that love them because they may not be ready to have those discussions. Certainly, my hope is that all providers are listening to their patients, and that if your provider is not listening to you in regards to your struggles or your concerns or your desires, especially when it involves stopping the treatment you're on or having a referral to hospice, my recommendation is that you search for other providers, because it is not the patient's job to be making sure that their providers are comfortable with their own decisions in terms of end of life. Yes, we can get very emotional as providers. We get very attached to the people we work with, but it is our job to listen to you It is our job to meet you where you're at and not impinge on you our own agendas. So first and foremost, make sure you have a healthcare team that is hearing you out. If you don't, then you may need to ask around for some referrals of other people. Yes, it's exhausting to try and switch providers, but end of life conversations and end of life treatment is as important as those other treatments that you've received from providers. So I want to make sure that you're with somebody that can meet you where you're at. Sometimes it's helpful to put out into writing what you're experiencing. Why are you considering this? What has brought you to this situation? It's sometimes even helpful for yourself to sit down and write about what you've been through in your metastatic disease, what you've been through since you were diagnosed with breast cancer. What are some of the things you've struggled with? What are some of the things you've even enjoyed? And kind of write those out if you can get those in a timeline. And then it's helpful to put it in some form of an email or a letter to your family. And what I like to do, especially if you have multiple family members or friends that have been involved in your caring for you, or that are involved in your life, I like to see that everybody gets the same message at the same time. So I'll often have people send out an email saying, these are some of the things that I've been thinking about, and I want to have a discussion about them. And those go out to the same people at the same time. And then there's a time set up to have a call. Now, in today's day and age, a lot of these conversations are happening on Zoom. There's nothing wrong with that, sometimes on FaceTime. But we definitely want to have the important players in the room at the same time so that there's not all this miscommunication and assumptions on our family's part. When you sit down and actually have these conversations with people, I'd like you to ask people to hear you out before they respond. And we want to ask people to hear us, or to listen to us, to hear us, to truly hear us, not listen to respond, because that's very different. If people are truly listening to you so that they can hear you, then they are just being very present with you. If they're listening to you to respond, they're in their head and they're not necessarily holding the space and really joining you where you're at. I also think it's important to say to your family that this is something you're considering, that you also want them to know that you may change your mind and you may not. And if they say, don't talk like that, it's not time to talk like that, you're going to do fine, you've been doing fine. Again, that's where you need to set some boundaries and say, I need you to listen to me. It's important to reiterate to your family what means the most to you. If it's feeling okay so that you can travel, if it's feeling okay, maybe some people are having chronic diarrhea because of their treatments, and that keeps them homebound because they don't want to go out and do anything. For many people, that isn't necessarily quality of living. That isn't necessarily leaning into what matters most. So we want to reiterate to our family and our loved ones, this is what matters most to me, and I'm not experiencing that right now. I also think these conversations are really important because they should be seen as a continuous conversation, not held and waited until the very last moment when things are kind of in crisis mode and you maybe don't have a lot of energy. These are things, just like with your provider, that I would encourage you to kind of talk along the way with your loved ones. That if it ever got to the point where you were not able to enjoy things like going out for lunch, or not able to go to your child's soccer game, or not able to travel, that you would want to reconsider the treatment that you're on if your symptoms and your side effects are caused from a treatment. So these are conversations, again, that I think we need to have along the way and not just save them. If your family shuts you down, then my hope is that you can go to friends who can support you. It's really important that our agendas, our needs, our desires get heard, and that we be very, very clear with people that this experience and this conversation is one of the few things that you feel that right now you can control in your life. And that so many decisions about what's going on are being made by the disease itself, and that it's not really in a lot of people's control. Also, I think it's really important, as many of you have seen the documentary that the wonderful Judy Erdahl created prior to her death. It's really important to think about this not in terms of giving up. This is not about giving up. When you decide you want to go to hospice or you want to be off treatment for a while and try it, this isn't about you giving up. This is about honoring what is. And I'm going to say that again. This is about honoring what is in front of you, what is going on, what is in your intuition, what is it that you're experiencing, what is it that you and your healthcare team have talked about, what is it that is part of the reality. So this is never about you giving up. This is never about you not trying. And I will tell you that in all my years of working in oncology, especially with metastatic breast cancer patients, that I've never met somebody that hasn't done very thorough research, 1 to 2 to 3 opinions, talked with multiple people in the community, other survivors, talked with multiple healthcare professionals, read, researched, experienced all these things before they make decisions. So these are not decisions that are made impulsively, but I think in all fairness to our friends and family, ourselves, and our healthcare providers, it's very important that you continue to be transparent from the moment that it starts. Now, you won't know, and you shouldn't pressure yourself to know at the beginning what you're going to want necessarily at the end. But I will tell you, in all my years of working with people who have a terminal illness, and all of my years in working with people at the bedside, people die how they lived and how they live. And that brings me to another point, which is hospice is very much about living until you die. It's not about going to hospice and dying. It's about living until you die. And sometimes people live longer than we anticipate when they go to hospice because they aren't weighed down by certain treatments, because they aren't weighed down by all these side effects, and they are experiencing and participating in their life. But most people die how they live. So if people love a lot of people around, they're going to want that. If people love nature, they're going to want that. If people enjoy music, they're often going to want that. If people are more quiet and very faith-filled and just want to be very internal, they're often going to want that, and they're dying. And so I think what's important is for you to kind of come back. Many people, I've seen this with many patients, where they've lost themselves. There's like this before and after with the diagnosis. It's like before, who were they before and who are they after? And they can forget about those things that still coexist, that still exist in the in-between. Those things that you love, those things that are outside of the cancer experience, those things that are important to you, that matter to you, that you put your energy into. And that is what we have to continue to embrace. So if you are not experiencing those things right now, it's important to have that conversation about either changing your treatments or possibly stopping your treatments. Now, hospice, by the way, for those of you that aren't familiar, it's really about a very aggressive form of comfort, care, and support. And that for many oncology practices around the country, they can still keep in touch with their oncologist, because that's a huge loss to lose touch with your oncology team. But I think it's important to think about that this isn't just like, okay, I'm done receiving any care and I'm all alone now. That's a very scary way to think about hospice. I also think for families, they think that if hospice gets involved, that means that their person's going to die right away, or that hospice is going to come in and hasten death. Absolutely not. Hospice really comes in and focuses on how do we really increase your quality of living and make sure you're enjoying all of your life for whatever is the remainder that you have. And the focus isn't so much on the tumor markers and the scans and all that. It really is about how do you feel in this moment from a mind, body, and spirit perspective. And that's what we're going to focus on. So again, I think what I really want to reiterate is start these conversations and start them with an open heart and the most honest you can have, knowing that you can change your mind, reassuring your family that you will listen to them, but ultimately this decision has to be yours because you are the one truly living inside your body with this disease that is very cruel. And I also think it's important to lean into the metastatic community, like Living Beyond Breast Cancer, but other women and men who are living with this disease every day, and asking them to walk alongside you as you have these conversations. Every conversation that I've ever had with people looks different, but the things that remain the same are I want to be very present to them and just hear them out. Just because also that you have these conversations doesn't mean you have to make a decision. I think it's really important that you have people that you can at least process these things out loud with and not feel this pressure that because you said this, now you have to immediately do something. These often are decisions that are a process, but they do need to start early on and they need to happen often. So I wish all of you a sense of being centered and clarity and support and not feeling alone as you walk this continued path, and much peace for all of you during your treatments and also at the end of life. I think what's really important to remember is that you are worthy and your voice is worthy of being heard. And that includes all along the continuum of care, including the end of life.